Hello and welcome to NCTV, and we've reached the half century. Today is episode 50. Well done for sticking with me until now if you've been watching since the very beginning. I realise that most people have probably dipped in and out of watching whichever episodes are either more relevant or of interest to them, which is totally fine. But the aim is just to create a catalogue of self-help videos which you can refer back to and share with anyone as and when the need arises. So what is today about? Well, as we move into the 50s in terms of episodes, I thought it would be quite apt to talk about a condition which predominantly affects people in their 50s. And as the world was celebrating International Women's Day on Monday of this week, it is also relevant in this sense, because it is more prevalent in women. If you haven't guessed what it already is from the title of the episode, I'm referring to the dreaded frozen shoulder. So why is it so dreaded? Because people who do get it can be stuck with it for anything up to 5 years if you're unlucky. More commonly though, it would range for between 1.5 to 3 years, which is still a long time to live with a pretty excruciating painful and restricted shoulder. The good news is though, that it will get better, and there are things that you can do to help it, which we'll come on to shortly. Firstly though, just to tell you a little bit more about it, the medical name for frozen shoulder is adhesive capsulitis, which sounds like a mouthful, but when you break it down, it literally means adhesions in the joint, in the capsule. So the adhesions are a certain stickiness that can occur brought on by inflammation. And this often originates in the biceps tendon after a small injury, such as overstretching to reach and lift something in the back seat of a car. And the resulting inflammation can then spread to other areas around the shoulder. And because there are a lot of interconnected structures within the joint, such as muscles, ligaments, and bursas, these can also be affected and become swollen and painful. So aside from being a woman in your 50s, other risk factors for developing frozen shoulder are if you have rounded shoulder posture, if you participate in intensive sports, particularly shoulder intensive sports that is, do a repetitive manual job, have diabetes, have experienced a traumatic shoulder injury, or if you've immobilised your arm following a fracture or have had surgery around the area. To give you an idea on how the pattern of incident occurs, it's usually affecting 5% of the population and a 60-40 split between women to men. It usually occurs in the non-dominant shoulder, and it can be 15% of sufferers may get frozen shoulder on both sides. And there are two types of frozen shoulder: primary, which occurs for no apparent reason, but it may be linked with medical conditions, your posture, job, that sort of thing, or secondary, which is usually associated with a pre-existing condition, either intrinsically within the joint because of a rotator cuff issue, or extrinsically through a fracture, surgery, or trauma, such as falling on an outstretched hand. Upon developing frozen shoulder, there are 3 main phases. These are freezing, which lasts 2 to 8 months, frozen, which could be 4 to 12 months, and thawing, which is also 4 to 12 months. However, there is also another stage called the pre-freeze phase, stage 1, and that's where it's like symptoms of impingement, and in 50% of the cases, this can either go into full-blown frozen shoulder, or if caught early enough, it can be avoided. The freezing phase is called freezing because that's the stage where the shoulder rapidly stiffens up and you get sharp, severe catching pain around the joint, and it's typically characterised by night pain. In the frozen stage, night pain starts to reduce, but so too does the mobility even further. Pain also tends to spread to other areas of the shoulder, forearm, down the arm, into the hand, and in the triceps at the back, where you can get tendinitis. Things pretty much stay as they are in this stage for quite some time. Once the thaw phase kicks in, mobility will gradually increase, although unless treated, this can still take quite a long time. So that's enough information about frozen shoulder. What everyone wants to know is what can you do about it? I'll start with some immediate posture related advice that you can apply right away. And if I were to give you 10 of the best tips, these would be: 1, avoid a protective posture. And this is often where people hold themselves in a position where their arm is bent and cradled into their body with the shoulder elevated. All that's going to do is contract the biceps even further, which will exacerbate the problem. 2, keep the arm straight, which will help to separate the shoulder and allow fluid back into the joint. 3, continue to use it for most of your activities, but avoid those that catch it and cause the sharp pain. 4, relax the shoulder and allow it to swing whilst walking, and that will help to increase the blood flow to the area and encourage the healing process. 5, avoid heavy carrying, such as bags on the shoulder, as this can lead to a tear of the supraspinatus muscle, which is one of the rotator cuff muscles, and that can further complicate your recovery. 6, take regular breaks when working at a computer, and by regular that means every 30 minutes. 7, have a good back support with a good armrest as well while sitting in a chair. 8, when in bed, the ideal position for your shoulder is to lie on your back with a pillow underneath your arm and shoulder to support it. 9, avoid lying with your arms above your heads. And 10, be sure to maintain good overall posture. When it comes to treatments, traditionally frozen shoulder is treated with injections, tablets and surgery. Without boring you on the ins and outs of them, the other most common treatments are physiotherapy, exercise, cortisone injections, manipulation under anaesthetic, suprascapular nerve blocks, and a keyhole type surgery technique. However, one of the best treatment techniques that I've come across, and one that works significantly to speed up the rate of recovery, is called the Niel-Asher technique, which is a hands-on treatment and one that I have adopted to use personally, and it's one that I can certainly vouch for, having had many years experience administering this now. But rather than go into that too much here, because I know this video is already quite long, I've attached a link to the page on my website below which will describe this in greater detail. So if you'd like to investigate this further, click on the link. So that's all for now, and I'll see you next time for some more bite-sized bits to help your health flourish. Bye bye.